Hello, Psych 314A. This is our group presentation, When is Therapy Harmful? By Lauren, Darian, and Serena. Dating back past the days of Sigmund Freud, psychotherapy has been in existence, whether it is just two people conversing on issues in their life to create clarity, or someone attempting hypnosis in the days of mesmerism. Psychotherapy has been an ever-evolving science, and like many sciences, it has had its fair share of dark moments when we as human beings had to take a step back and assess if what we were using in the sense of techniques were humane and appropriate. There have been many questionable mediums of therapy that one could argue did more damage than good and crossed the lines of when therapy is harmful. Psychosurgery was one of these. Around the 1930s, psychiatrists were finding that they could alter certain things by altering the brains of patients by ways of shocking, removing parts of the brain, or breaking brain connections. Tests to confirm the surgeries worked were generally patients from insane asylums. After the mid-1950s, psychosurgery use began to decline as psychotropic drugs came about and became the preferred use of treatments for various mental illnesses. However, as our knowledge of the brain and technology have advanced, psychosurgery has had a mini resurgence for the more extreme cases. One of the most well-known harmful therapies is lobotomies. There were two types of lobotomies taking place when they first came about in the 1930s and 40s. In a lobotomy, doctors aimed to separate certain connections from the prefrontal area to the remaining parts of the brain, as those areas were thought to promote extreme emotion. Lobotomies were originally thought to treat depression, schizophrenia, and other mental illnesses. There were two types, the standard lobotomy and the transorbital lobotomy. The standard lobotomy consisted of drilling a hole into the patient's head and injecting ethanol into the patient's brain in order to sever the connections from the frontal lobe to the other parts of the brain. Later, the lobotomy procedure was updated and streamlined and then called the transorbital lobotomy, popularly known as the ice pick lobotomy, in which doctors performing surgery would access the brain with an ice pick-like instrument via the eye sockets in order to sever the brain connection. This form of lobotomy was then used and practiced overwhelmingly on patients in insane asylums, as well as were rumored to be used on minorities to control and restrict their free thinking and rights. Thankfully, in the 1970s, lobotomies were banned in various states in the United States. Electroconvulsive therapy, or ECT, comes from the lineage of one of the oldest forms of therapy dating back to the 16th century using electromagnetic machines. In the 1930s, convulsive therapy was introduced by way of triggering convulsions with drugs such as camphor and metrazole. Due to the side effects, the drugs were later replaced by ECT, which is now generally for treatment of depression and other mental disorders. It is the process of inducing a seizure by way of electrical shocks externally on the patient's head. Over the years, due to advances in science and technology, the technique has evolved to a less risky one. While it is a highly controversial treatment, it does have a proven track record for specific psychiatric illnesses and is still being used as a last resort option for certain treatments. Unfortunately, involuntary ECT is still a process. In most states, there must be a formal hearing prior to a patient being forced to undergo the involuntary administration of ECT. Another controversial form of therapy that still happens today is deep brain stimulation, also known as DBS. DBS first made its appearance in therapy back in the 1950s and 60s at the slow demise of harmful treatments like lobotomy and electroshock therapy. DBS is a surgery in which a device similar to a pacemaker is installed in the patient. The device then sends electric pulses to specified parts of the brain as treatment. It is currently being used as a treatment for Parkinson's disease, OCD, epilepsy, and a few other mental conditions. While this type of therapy is FDA approved and generally considered low risk, there are still side effects and surgery risks. Risks include surgery complications, post-surgery infections, and changes in personality. These have turned some people off from the idea of using this form of therapy as the side effects can prove harmful and irreversible. Scared Straight and other similar programs involve organized visits to prisons for children at risk of criminal behavior. It was first introduced in the 1970s. These programs are designed to deter children from offending in the future through firsthand observation of prison life. Since the introduction of these programs, many studies have found that they cause more harm than good. It is not an effective crime prevention strategy. A study of the original New Jersey program reveals no effect on delinquency or criminal behavior. Studies have shown that these programs actually lead to increased offending. These programs fail to deter crime. It is cost inefficient. Scared Straight style programs usually cost less than $100 per child, but research from Washington State Institute on Public Policy found that for every $80 spent, an additional $14,000 is spent for the children's recurrent contract with juvenile and criminal systems. Psychedelic therapy. Psychedelic therapy is a technique that involves the use of psychedelic substances to aid in the therapeutic process. These psychedelics include ayahuasca, originating in South America, that can help with anxiety, depression, and addiction. LSD, lysergic acid diethylamide, can lead to altered perceptions, mood, and consciousness. It can be used to treat addiction and anxiety. Psilocybin, similar to LSD, this also affects perceptions, mood, and consciousness. It can be used to treat addiction, depression, and anxiety. MDMA, or ecstasy, causes feelings of euphoria, altered perceptions, increased arousal, and increased sociability. Research suggests it can be used to treat post-traumatic stress disorder. There is no current standardization method to administering these psychedelics, but there is common elements. Administration of a low or moderate dose of the psychedelic drug, supervision by a professional during psychedelic experience, and repeating the psychedelic dose within 1 or 2 weeks between sessions. Things to consider before psychedelic therapy. Negative psychological reactions. This includes symptoms of anxiety, paranoia, and panic. This is also known as a quote-unquote bad trip, where intense, terrifying feelings are present and things feel out of control. Possible personality changes. Some have suggested that these drugs have the potential to produce long-term mind-altering and personality-changing effects. One study found that psilocybin therapy was associated with increased extroversion and openness. Dangers of self-treatment. This posing a number of risks including bad trips, the possibility of drug interactions, and the fact that manned street drugs can be mixed with unknown and harmful substances.
All right, moving on to conversion therapy. Now, conversion therapy is any attempt to change a person's sexual orientation, gender identity, or expression. And after many years of reputable medical professionals raising ethical complaints and speaking out against this harmful therapy, many states, including California, New Jersey, Oregon, Illinois, and Washington, D.C., began passing legislation and banning conversion therapy. And in 2015, the Obama administration called for a ban for youth as well. Now, to avoid detection, this may be called other things, such as sexual orientation change effort, sexual reorientation efforts, promoting healthy sexuality, encouraging relational and sexual wholeness. So these are called by many different names. These therapies are overwhelmingly ineffective and harmful. They use individual talk therapy, behavioral stimuli, group therapy, or milieu, and these are better known as retreats or inpatient treatments. Here's some background on conversion therapy. Up until the 1970s, homosexuality was still considered a psychiatric disorder and was in the DSM. Aversion therapy came about to cure this disorder. Unfortunately, it is still commonly used today and may include the use of the following: talk therapy to try to identify the cause that caused homosexuality stems from. Medications, these might include hormone injections or antipsychotics, electroshock or electroconvulsive therapy. These aversive treatments use electric shock to hands or genitals, along with nausea-inducing medication. These are administered along with homosexual stimuli, such as homoerotic video. They may also employ exorcism, force feeding, or food deprivation, isolation, hypnosis, beatings or other corrective violence, and even rape. Many practitioners believe that these patients will begin associating the negative feelings with their homosexual thoughts, and that this will cure the patient and make them heterosexual. This therapy has lifelong effects on its recipients, and many will never fully recover emotionally. Regardless of your moral or religious beliefs on homosexuality, it is clear that conversion therapy is not only harmful, but ineffective. In fact, multiple professional organizations, including the American Psychiatric Association, the American Psychological Association, and the American Academy of Child and Adolescent Psychiatrists have all found that there is no evidence that this therapy has ever resulted in sexual orientation changes. There are numerous studies that show that this therapy is not at all successful, and many accounts from survivors describe horrible, torturous conditions. The American Psychological Association has issued a resolution. It advises parents, guardians, young people, and their families to avoid sexual orientation change efforts that portray homosexuality as a mental illness or disorder, and to seek psychotherapy, social support, and educational services that provide accurate information on sexual orientation and sexuality, to increase family and social support, and to reduce the rejection of sexual minority youth. So how harmful? Since these patients do not change, they may feel even worse about themselves, questioning their own faith, and may feel that they're broken. San Francisco State University found that LGBTQ people who were rejected by loved ones and entered into conversion therapy were 8.4% more likely to attempt suicide, and overall, 42% of LGBTQ youth seriously considered attempting suicide in the last year. This is more than 7 times that of their peers. 5.9% more are likely to experience high levels of depression, and 70% overall report poor mental health. After conversion therapy does not work, these patients may become even more vulnerable. Many patients describe treatment as torture, and they may lie to their therapist just to make the treatment stop.